Okay, everybody, welcome to this first of many, many meetings, which we hope will result in a fine county budget for 2023. I just want to make a couple of observations for the benefit of those of you for whom this will be your first budget experience. You will be pleasantly surprised to know that this process involves the circulation and consumption of copious amounts of candy. But as sweet as that is, I really want to emphasize to all of you that this is probably the most important public service that we perform as a county legislature. And we can joke around and we can be congenial, but we need to take this very seriously. The other thing I hope you'll all remember is that we are going to be hearing from 58 departments, budgetary units, and not-for-profit organizations that our budget supports. And so we need to run these meetings, in the words of Leslyn McBean Claiborne, crisply. It's a fine line sometimes between understanding why a department needs the money and how they're going to use it, and getting into the weeds about the nature of the program and services that they offer. We really need to confine ourselves to questions that bear on the actual budgetary needs of the department and not the services that they provide. If anybody crosses that line, I will jump on them. Sorry. And with that, we will move forward and I will turn it over to Lisa.
Can I mention something? As long as we're doing preliminaries, everything you said is terrific. That's exactly right. But just so everyone knows, we have a budget process different from almost any other place. And the reason we have, and the reason we spend so much time on it is transparency, so that everybody on the legislature knows where the money comes from, where it goes, and has a voice in how it's going to be spent, including whether we have to raise taxes or not. So I just wanted to say that, and thank you.
Thank you, Mike. You've chaired a lot more of these than I have, so we appreciate your input. Lisa, take it away.
I think I'm going to turn it right over to Frank Krupa, our Director of Mental Health and Public Health, and he's going to be presenting on both those budgets. Yeah.
And those presentations can be found in your budget books at pages 4-84 and 4-141.
All right, good afternoon, everyone. It's good to be back. I don't know that I've been in this room in a few years. So it's good to see folks in person. Yeah, so as Lisa said, I'm going to be presenting the two budgets. I will be crisp, as the chair asked, really just focusing on some major impacts and then the high level budget, leaving lots of time for questions and talking about OTRs. I will be presenting public health first and then mental health. I do hope that this will be the last time that they are two different things. We are close to formally bringing our charter revisions to the legislature, likely in October, to merge the two departments together into a single entity. So looking forward to that. So up on the screen, you'll see some of our WIC staff at the Public Health Department. So first up, major influences. The thing that's influenced this budget the most is after, 10 plus years of advocating with the state, it only took a worldwide pandemic to get state aid increased for public health practice. So for those that are unfamiliar, the way that our state aid, it's Article 6. The way that it works for the health department is we get a base grant, which covers 100% of core public health services. So there's a very small list of what those are. It's communicable disease, some of our environmental health work, but it's probably less than a third of the total work that happens at the health department is state aidable, but it is still a substantial contribution from the state. Our base grant is increasing from $650,000 to $750,000. So what that means is for the first $750,000, that we spend on those core public health services, the state will pay 100% of that cost. It used to be minus the fringe cost. So that's the other added bonus that we got and is more significant. They are now making fringe costs an allowable cost. So in the past, for all that work that was being done as core public health, the staff that did it, we were not able to include their fringe costs, which, as you know, can be upwards of 50% of their actual salary too. So that was a big addition, and it's resulted in several $100,000 of additional state aid for the same amount of public health work that we were doing. So it really was a win for us. It's something we've been advocating for at the state level for a long time. And thankfully, due to the influences of COVID and recognition that public health needed to be shored up foundationally, they've granted that to us. So what it's allowed us to do really is address most of the OTRs from last year that were granted in one-time funding to allow us to move them into our target. And those were some positions in particular. One of the environmental health positions that was added last year was added as one time. It was the water resource sanitarian, or what we now call environmental health specialist. So we were able to make that a target position within our budget. And then we also had 2 community health workers that you all give us funding for in 2022 on a one-time basis that we've now been able to make target in our budget, all without asking for any additional resources. So we've been excited that we've been able to make some of these changes and not have to come to the legislature for additional funding to do it. We've used some of the additional state aid to shore up some of our other operational lines and make sure that we had the appropriate funding for existing programs and services and fund them at the appropriate level. So good news on that. You will notice when we get to our FTE that our FTE count is way up. And that's, for us, we think that's good news. That is really in large part to some grants that we've received. So I think you're familiar with our Public Health Fellow Program, which was something that was created under former Governor Cuomo to create additional public health workforce. And so we were granted funding for 7 positions and a supervisor to bring on public health fellows. I think we currently have 4 or 5 of them filled, and we are, continuing to look for additional folks. That funding is good currently through, I believe, June or July of 2023. We are hoping that the CDC will allow the state to continue to use the unused funds to extend the current work further into the future, but we don't know that as of yet. But it is no cost to the county. So those positions are fully funded by the grant. And then we also came, I think it was the end of, it might have been earlier this year, about another grant that we got called PICH, P-I-C-H-C, and it is for our additional community health workers too, and a supervisor for all of our community health workers to help with our maternal and child health programming. So really those positions are designed to have people that have lived experience that we can bring on board that can connect us with communities that we might not otherwise have reached and learn from them about what their needs are, and then hopefully bring them services that they find of value. We are also adding an information aid position to the department to serve as administrative support and community health services. This was a position we had downsized during the COVID reductions in 2020 budget. We had thought we might be able to sustain that, but with the growth of our community health program, including the fellows and the pitch program, it really was necessary for us to bring that back into the budget. And then one other thing you'll see in the FTE number is administrative staff. So as part of the merger, one of the major efficiencies we're hoping to, and we've really already realized, is by merging together the administrative functions of the 2 departments, we've created redundancy. So we have more people that know how to do the work. And we've also been able to share the workloads across different staff. So we now have almost all of our administrative staff performing functions for both buildings, the staff and the work that goes on in both buildings. So in order to make sure that we were accounting for that in our state aid appropriately, we had to move some FTEs around, partial FTEs between the public health and mental health state aid accounting in order to make that work. So you'll see parts of an FTE in there that's what that accounts for. So that's really the major influences on what has hit the budget. I'll run quickly through the kind of the things you're used to looking at. The overall budget numbers here, they look weird, mainly because there's so much COVID money in 2022 that won't be there for 2023. So both our expenditures and revenue lines are down accordingly in 2023. The full-time equivalents, as I was outlining, the number has gone up pretty significantly, and I outlined, where those positions are coming from. It's our fellows, it's the pitch grant, it's the community health workers, and that what is a 0.9 FTE is the mixing and moving of parts of the administrative staff between the two departments. You'll see something similar on the mental health side in the full-time equivalents as well. All right. And then that brings us to the over target requests. There's 3 here. The first one, you may recall last year, you gave us some one-time funding for our public health sanitary code update. Some of that work has occurred. We did an RFP and we're unsuccessful in finding someone that was interested in helping us through that. So we've been using some existing staff, some interns. So that work continues, but we didn't spend much of the money that you had allocated in 2022. So we're asking to carry that 16,000 over because we do expect there will be some expenses in 2023, particularly around advertising and creation of the actual sanitary code, because it's similar to the charter in its approach that it has to be publicly recorded and such. So that was a one-time for next year. And then the public health vehicles, Lisa might have to help me a bit with this, but I think you're aware that the vehicles are all coming under the county as part of a capital project. We are able to leverage that state aid I was talking about on a portion of those vehicles, but they have to be in our budget. So we are budgeting for them here. Lisa is accounting for them in the capital project, but that's why it presents here as an OTR. Did I get that?
You got it.
Okay.
So that money wouldn't come out of the general fund, it would come out of the capital.
But yes, but we have to incur the expense in the health department's budget.
Right,
Yes.
yeah, I understand that piece. Thank you.
And then the last one is the increased livable wage, which is related to the information aid titles that we have, where obviously those need to be kept up with the increase to the livable wage. And the county has made that adjustment for us in the budget, but it presents here as an OTR. I think we have 4 left. I can get back to you on exactly what the number is. Our total fleet is 16, but much of it is already, we've been electrifying the entire fleet, so we're close to having that project completed. But we are actually now also getting to the point where we have vehicles that are aging out, even that are electrified, that are going to need to be replaced. So part of this is getting on that replacement schedule. It's 4. Thanks, Lisa.
Annie, speak into your microphone, please.
You're asking about the OTR? Yeah, it's 4, or you were asking? It's 4 electric, one hybrid. So it's 5, looks like.
Oh, you're correct. And 1 hybrid, yep.
Sorry, I'm just focused
you.
on, I know everything about electric vehicles, so.
Can you find some for us? That's been the hardest part.
Not that you could afford.
Yeah, that's true.
Don't be snarky, Annie.
So that is the extent of public health. Did you want me to stop for questions there or just go through mental health and then do it all at once?
Well, why don't we see if people have questions?
Okay, great.
Mike Lane.
On our big sheets here, which I'm glad to see again this year, your third over target is titled increased costs for civil service mandates. Is that just a title for it, or you're saying it's for increasing positions to a livable wage?
The livable wage is correct. Is
So
that?
it's not a civil service mandate then?
No,
Okay, thank
No.
you.
that got pulled from a different field apparently.
Okay, we have a question from someone who's attending remotely and then a question from Amanda Champion. Taylor, why don't you tell me who's, okay, Shauna, go away. No, sorry,
I'm already away. I'm in Texas.
we're sorry.
Let's see here. I have a question in regards to section 4, page 84, under the program expense. And it appears that last year we had budgeted $124,070. And this year we budgeted $94,000 in target. But in 2021, we only had $12,000 in that line item. And I'm wondering, I understand that much of that was probably due to COVID, but why are we still seeing high numbers for 2023?
Frank, do you want me to take that? It's
Brenda, I was just going to say, if you're on, could you add some insight?
Sure. So we did put some funds, we do have a capital request out to do some renovations of some space downstairs to accommodate mental health clinic services. And we did put some funding in, likely going to be for equipment, but until we can solve what all of those needs are, we put it in one line for right now. We do have some program expense money that is probably closer to that 12 to 15,000. But the larger sum of it is related to our capital project piece where we have funding to help support that.
So essentially there's $80,000 that you're asking for extra in target for this line item that should be to renovate?
No, so the renovation is part of the capital project, but then we have to have furniture, right? We have to have things that go into the space. And so we're trying to budget for that part of it through program expense.
But
Okay, so that would not be under capital equipment or other supplies?
Correct, I believe so.
I
Okay,
guess I'm a little confused because if it's something that it's going to be a one-time expense, I don't understand why it's included as a program expense in target.
I think that's my question too.
We had target money that was available, so that's where we put it for right now. We also put in there funding to do our all staff meetings for both, today for both mental health and public health. We also have money in that line for that. We had target money available when we did the budget and when the capital was done. Construction costs are skyrocketing. We've seen that, or I've seen that in other proposals. So we didn't know really what would get covered. It's a real preliminary. Since we had target money, we put money aside to do whether it's a group room or office furniture or what have you for that space.
I guess my question is, why are we making the pot of money and calling it target whenever it should be the actual goal and the actual target, like a lowered amount? And then, my idea, and maybe I'm wrong here, is that if we're doing something that's a one-time, that it should be an OTR. I mean, the accounting just doesn't seem accurate on that. It seems like we're going backwards here, where it sounds like you're saying I have a pot of money and we're trying to spend it in this certain way. Ideally, we should be working backwards and saying the pot of money should have gone back to our 2021 numbers. And then we have these expenses and it should be in a one-time request.
So we can certainly parse out the one-time component of that. It's not just, and I apologize for not being more clear, it's not just for the furniture. There is that we are budgeting for regular routine, all staff meetings where we can bring the whole department together. And those are costs that had been in the budget previously. We can certainly parse that out. It was an attempt to use target funding that we have, as we described. There's additional, because of the increase in state aid, there was more flexibility in the target for us this year because we were receiving additional funding from the state. There are other needs. We were trying to be strategic and offsetting things that we weren't looking to ask the county for other additional funding for. So we're not asking for additional target for these things. It's target that existed, and we were trying to, again, support the ask for the capital project without making that number be higher than it needed to be. So we can go back and parse that out. It's not going to impact the target necessarily because there are other things that we probably would have prioritized if we hadn't prioritized supporting that capital project in that way.
Yeah, I think it'll just help us out at the end of the budget whenever we, especially whenever we look at next year's budget, because there are going to be some things like your capital projects we're not going to have on an ongoing basis. And your ongoing training, that is in fact going to be something that we're going to continue. So I think that would be helpful for future budgets as well.
Fair enough.
Thank you.
Okay, Amanda.
Well, that was actually one of my questions as well. I noticed that. And then also on that page, this is not a criticism. This is just part of the, document that can sometimes be hard is when there's a line that says other supplies and professional services and program expense. Like, we don't always know what that means. And so I'm always wondering what other is. But anyway, in this case, I'm looking at the professional services line, which has gone up and down quite a lot over the past 3 years that are here. And I guess I'm just wondering if that's COVID related or what is in that line.
Yeah, the up and down is certainly COVID related. I think you're also looking at the roll up on that main page. It is, Brenda, correct me if I'm wrong, but there are portions of that throughout the different functional units within the department. So different functional units have needs for professional services and program expense and such, and those are in those particular areas. There's not detail of what a program expense is. That's unfortunately the system doesn't break it down to that detail. Brenda, did you want to talk about the the up and down of the professional services?
Definitely the higher amounts are like the 2021 actual is really tied to COVID response activities. I will say that there is funding in for the COVID ELC school grant in a separate functional unit. And that I think we put in at about $1 million. So there is COVID money in next year. Again, they're grants that some carry to 2023, end of the school year, some carry to 2024. But we took a best estimate of what the school grant would be and put that funding on the books. So that probably $1 million of that is tied to the actual school COVID grant.
Okay. And then I just wanted to confirm, you talked about the FTEs and the public health sanitarians and the environmental health technicians. That's just like a transfer of title?
Yes. Yeah. So we used to call folks sanitarians. It's antiquated language. So we changed them to environmental health specialists.
Okay, great. Thank you.
Randy.
Thank you, Amanda. You beat me to that one question. You talked about this, Frank, early on about the employees that you're adding and the grants you're getting. Is that why the target salaries have gone up 1.2 million primarily from last year?
Yeah,
this year, I'm sorry.
It's in large part to those 8 public health fellows. So that's 8 additional positions that are completely grant funded. So the expense associated with them has a significant impact on the salary line. in the department.
So when they say target, that's your target for this year, doesn't necessarily mean it's going to continue for years going forward. But that's-
Well, as long as the grant continues, it would be. So it's in our budget as operational. It's not, we don't call it one time because it was over multiple years from the state with a grant, but they are tied to the grant. So if the grant went away, the positions would go away.
Thank you.
Okay, anything else before Frank moves on to mental health? Norma?
I just wanted to mention that in section appendix C of your book has all of the account numbers that roll into those other lines. It is confusing when you don't really know what rolls into them. So just so
Okay.
you know that in appendix C, that all is laid out for you.
Great, thank you.
You're welcome.
Okay, Frank, I think we can move on to mental health.
All right. There you see all of us together. We're fortunate to be able to have an all-staff meeting with both buildings coming together and we took a group photo. So major influences with mental health, you'll see with 2022, 2023, and some of the comparisons, you're probably all aware that at the end of 2021, we're in 22 now. At the end of 2021, we had to slow down intakes at the mental health department because of staffing shortages. So that really has been the theme of 2022. We had significant turnover in the department. We've been fortunate to fill a lot of those positions. And so we're in a much better place now. Intakes have picked up and are getting closer to where they were pre-COVID. We're not there yet, but we're getting closer. But one of our biggest challenges, and you all have talked about this in other settings, is our ability to remain competitive in the hiring market, particularly for licensed professionals. It's extremely difficult. Our salaries traditionally were a little bit lower because our benefit packages made up for that and people were willing to trade working 8 to 5, having a pension, health insurance that was, better than what they would find in the private sector. We don't work 8 to 5 anymore. Our retirement benefit, quite frankly, has been eroded through the different tiers that have been established and really isn't beyond, it is, I would argue it's not competitive with what's found in the private sector for compensation related to retirement. Our health insurance is now pretty much on par because we've moved down to that, to whatever the platinum tier or whatever they call. So what we're hearing from the people we're interviewing is that they have better offers, right? We're getting to the point where we don't even get a chance to interview them and they already have another offer. And we talk to them, we say, hey, come in, we want to talk to you, at least give you the opportunity. They ask about the benefit package, the compensation package, and it doesn't compete. We have some issues that we don't have a lot of control over in that area as well. Our license requires us to be in person 50% of the time. So particularly for mental health clinicians, you can work 100% remote with a lot of different opportunity to do that. And we just unfortunately can't offer that because of the type of license that we have. And we also, we deal with civil service, right? There is the challenge that's associated with, trying to bring people on board. Folks don't want to leave a job they already have for a provisional appointment where they have to wait to see if they take a test and then are reachable. So we've had some significant issues. We're excited about the salary study and hopeful that will, shed some light on what we're dealing with. But it is critical, and it's really, we never want to say that we have to slow down intakes at the department. And that was a hard thing for us to have to do, but we had no choice. And we really don't want to be in that position. So that's been a large part of it. We have budgeted for some additional therapists because demand has gone up. 3 of them, to be precise. 2 will be assigned to schools. So our school program is growing. It has grown this year. We're adding a middle school at the City School District, and we know there is more demand and more interest from our other districts that we serve as well. We are able to generate revenue with these positions, so they generally are cost neutral So we're not needing to ask for additional resources for that, but we do want to add those positions. And the third one is a social worker in our clinic. Really, we're creating that position because we want to have continuous recruitment. We kind of know what our caseload is right now and the number of people that we need to do that work. And if we have one vacancy, their 100 people that they're serving have to be spread around other people. So we're hoping that with this additional position, it will allow us to be continuously recruiting, as we know we're going to have attrition in our ranks that will at least be at that minimum number to maintain for what we're doing. And if we get to a position where we have all of the positions filled, it would just allow us to expand the services that we provide. And there's, of course, demand for those services. So we're trying to be strategic in our approach. One thing that we've also added, which will be an impact to the budget, but that we've been able to cover, is we've become a loan forgiveness facility. So the folks that work for us can get loan forgiveness if they work for us for, I think, at least 3 years, but they have to be 40 hours. So we moved, I think, 8 of our social work positions up to 40 hours, so they would be eligible for that program, and they are taking advantage of it. So we're happy to be able to provide that. We also hope that might be an incentive in recruitment as well.
The college loans?
Oh, I'm sorry, I never put it in. Came all this way and I'm still on Zoom.
Frank, I think Rich has a question.
Loan forgiveness, do we pay for that or is that at state, federal?
No, it's not, no cost to us. All we have to do is be a facility that is covered because of we are a safety net provider. Yep. All right. And then the other thing that probably is going to be a bit of conversation throughout the budget process is related to the mobile crisis team. I think you're all aware, we've talked about this, the increase for demand on services of that team, coupled with the conversations around public safety reform, has really impacted the demand and need. And we designed this to be kind of an additional thing to add to the cadre of services and support law enforcement and those in our community when folks were in crisis. And so we're using existing staff with an on-call model. And what that does is that whenever there's calls, it's pulling the staff away from their other work, right? They're unable to see clients, it's disruptive, and it really is wearing on the staff. Last year at this time, I was talking to you about increasing the on-call just so I had people to be on call, the payment for on-call, with some expectation that the public safety reform conversation would have been a bit further along this year with kind of the holistic picture on how we want to have alternative response in the community. But we're not there yet. And so I'm at a critical point where I don't think that I can maintain the current mobile crisis team into 2023 in its current status, right? Because it is just draining staff. The staff that are doing it are leaving because it's just too much. It's causing chaos for the people that we're trying to serve because their missed appointments are being rescheduled and canceled. There needs to be a different approach to that. And so we've offered a potential solution as part of an OTR, but those two things, the staff retention and then the impact that the mobile crisis team demands have had on the department, have been the biggest influences for us as a department and financially as well. So our recommended budget is here. And you can see the changes generally are attributable to additional staff, but those additional staff bring additional revenue as well. All right. And then on the FTE front, you'll see there's 3 positions different here. And those are the 3 positions that will be addressed in the OTRs. 2 of them are related to the mobile crisis team, and 1 of them is related to our mental health resource court. So I'll just get right to those. So the first OTR is the mental health resource coordinator position. We do this one time every year because it should be a court position. For those of you who have been around for a while, you've heard me say this over and over again. We have tried to advocate for the court to take over the position, but it hasn't happened. And I don't want to move it into my target budget for fear that they will think that we can pay for it and don't need them to take it over. So it will come to you as long as we're doing it as a one-time OTR, but it is our top priority. I hope you've heard from your constituents or perhaps the judges, the value that it has provided to the people that are being served by the court. And so that's here as our first OTR. I'll come back to the second one because that's the largest one. I want to spend the most time on it. The 200,000 for the Alcohol and Drug Council was an OTR that came through last year. That was a 3-year funding request. If you'll remember, it decreases in value. I believe it was 250 last year. It's 200 this year, proposed for 150 next year. I'm sorry. In 2022, it was 250. In 2023, 200, and then 150 in 2024, and then it would go to zero. The purpose of this was the facility up on Trip Hammer Road. They have to get it operationalized, and as you can imagine, revenue is driven by people served. You have to pay the staff to be there before you're fully at capacity as you're ramping up, and so it really was an effort to help the ADC get that project off the ground. And then the fourth one there is actually the only OTR that's not recommended in the county administrator's budget. And this was a request from the Mental Health Association. They have created a drop-in center. If you were familiar with the previous Jenkins Center, it's kind of modeled against that. They've rented a space on the Commons. It's really designed for people that have some mental health issues or concerns, and to have a place to drop in and be with peers or seek out service, but have a place to go. And it being centrally located on the Commons makes sense. The challenge is I don't know that it's a sustainable model. And so I think that's part of the reason that it's not being recommended in the budget at this point. I will tell you the Community Services Board has voted to support the proposal. We certainly think it's of value, but I think there's some work that needs to be done on the sustainability of the project over time. And then going back to the big one, the co-response team. So as we were struggling with the mobile crisis team, talked to Lisa, county administrator, and then talked to the sheriff about, what can we be doing to try to make sure that the mobile crisis team can continue to function, knowing that there is still this broader public safety reform conversation happening. And the co-response team model is something that we've seen in most places that have some type of alternative response. It either started with a co-response model or there's a co-response component to it. And that's really where this came from, was a way to move the mobile crisis team from a part-time coverage thing through our clinic into a standalone kind of response effort. And so working with the sheriff and the undersheriff and Lisa, we came up with the proposal to start this project with a 2-team approach. It would team a licensed clinical therapist, so one of our social workers that we would hire through our department, with a law enforcement officer, either through the sheriff's department or IPD. And what I imagine in that is that they would be on during the hours where we have the bulk of our calls, which are normally daytime hours. And that would offset our folks in the department, in the clinic, needing to respond. We would have these teams available to be able to go out on particular calls. We would have to delineate, what are the particular calls they're going to go to. I have responsibility for the entire county, right? So for me and the people that work for my department, we don't have the jurisdictional lines that the law enforcement folks are faced with. But we know, a large portion of the calls come from the city of Ithaca. And, with Lisa's leadership, it does make sense that, the city be a partner in that process. So as the OTR is proposed, it would be 2 licensed clinical therapists in the mental health department, with a deputy type position, I believe is in the sheriff's budget, and then seeking support for the other law enforcement position from the city. There's a lot of different ways that that could be developed, and I know you guys will deal with the jurisdictional lines and have a lot of questions about all of that that are not in my world, but I just want to say that it's important from my perspective that this be a team of people and not one team that's the cities and one team that's the counties, and never shall the lines cross, right? Because that will be less effective in its approach. Where the funding comes from, whatever you guys tell me is, we'll be happy with. It's really about when we design the program, we want them to be able to respond anywhere in the county, regardless of, where the funding is coming from. So that way it's a team approach. Those people can be together. The social worker and the law enforcement person should be a team that are working together on a daily basis. So they get to know each other. They can think, they can learn to know what the other is thinking and be able to respond most effectively. So there's a lot in there, and I know the sheriff will have some to share as well. But from our perspective, this is a response to the fact that our current mobile crisis team is unsustainable and it's causing havoc. There's no other way to describe it in our clinic while we're trying to provide service to those that are most in need. And it's almost creating this loop, because as we're being pulled from the clinic to go to those crises, people are not receiving service or getting ineffective service because of the change of appointments and such, and then that results in them devolving into crisis and more need. So it's this kind of vicious cycle. We've got to get ahead of it and have a way to approach that where it doesn't impact the daily operations of the clinic. So I think that's my.
Okay, thank you. I have a question from Shauna and then Randy.
Thank you. Thank you, Frank. I have a few questions, one of which for the mental health court, I know whenever this was proposed, I don't know, maybe 3-4 years ago, we were very hopeful that after the first year that the state would pick this up. And we continue to obviously pay for it on the county end. And I think we need to continue to pay for it. However, I'm wondering if there is some lobbying that can be done to our state representatives, or if there's an application or grant process. How is it that other counties, I know that Auburn actually has their mental health court and it is subsidized 100% by the state. How can we get into that gig?
Yeah, it's a really good question. And to be honest, Martha was our advocate prior to her term ending. She was pushing really hard to try to get this on the attention of the folks in Albany. My understanding, the way that the court system works, and maybe the way that it was explained to us is that there's a limited number of positions. And the way that the court system works is that to get a new one, it either requires legislative action or they have to take a position from another district or another place to make that happen. To be honest with you, I don't know enough about the court system to be able to really speak intelligently on it. But I think, to your point, we do need some active advocacy to make that happen. I know one of the responses was, well, we just gave you a judge and now you want this too. So we're in the middle of all of that too. So I'd be open to anyone that that knows more about this and can help it. Honestly, it landed at the mental health department because it is a mental health court and we thought it was important and we wanted to get it off the ground, but I'm not a court person and
It's okay, Frank. I don't think it's your job. I think that's something that we should be doing at our level, and Shauna and I can try to get that moving.
Yeah. I just, it's definitely important and it seems to be working. I think both people that are going through that system, the judges really appreciate the outcomes. And I think it's a good investment. And so Deb and I will work on that. The other question I had, I know that we had the OTR with the Alcohol and Drug Council. I'm wondering if a portion of that can actually, a portion that we've promised can come out of the opioid settlement funds that we've received.
I guess that's a question for Lisa and Norma, isn't it?
Well, I can answer programmatically. I think the short answer is it could. I think the opioid, we're in the process of trying to figure out how to best spend those opioid funds. And we're going to be providing some information at the next HHS meeting on some thoughts that we have both around perhaps a task force and how the money might be able to be spent. I think ultimately it will be up to the legislature to decide on how to best allocate those funds.
Okay. And then a few other questions. I was wondering, I know that Alcohol and Drug Council provides people with assistance, but we also have CARS and Reach Medical that does equally important work. Are those agencies also going to receive funds from the county?
So CARS, oh geez, you're quizzing me. CARS and Reach both get money through the county. I'd have to double check on whether they get actual county money for that. And the Drug Council brought the request forward specifically related to the opening of the facility up there. And that's why it was considered last year. I believe there were other requests made as part of the budget process that were not ultimately funded. So anyone that's interested in the mental health department bringing forward OTRs on behalf of their organization, we've never not listened to them as far as, bringing them forward for consideration. There wasn't any this year.
Okay. I just want to make sure, because I know that Reach specifically went to the encampments and helped so much during COVID. And quite honestly, they're the reason why many of our residents stayed healthy and stayed alive. And I know that they continue to do that outreach. The other question, I guess I just wanted to put out there is that the mental health drop-in center, I actually think this could be really successful. I think what we've seen is through peer advocacy and peer outreach. I mean, we've seen it through the WIC clinics. We've seen it through some of the other public health work that we're doing. It's able to capture people that wouldn't traditionally walk through our doors. So I realize this was not recommended by our county administrator, but I will be filing a member filed OTR for this. So I just wanted to give you guys a heads up.
Thank you, Shauna. Okay, I've got Randy and I saw a hand over here. Is this at yours, Mike? Yeah. Okay. And then Taylor has Dan. Okay. Just a heads up, people. We're getting close to time on this presentation.
I just have a process question, make sure I'm reading this table correctly. Lisa, so if I'm looking at the co-response teams and it says the 376 in blue is what was requested, I guess, is that what spending means? That's what was requested. And then looking down at the spending, it's 258, 574, that's what's recommended. I'm trying to understand how this flows. So you've got spending, source of funds, I get that, which is, but then it says spending 258.
Andy, are you looking at this?
I'm looking at this OTR request table.
Okay.
And it says, we just talked about the co-response teams, right? And it says 376, 463 is that what was requested?
That's what, yes.
Okay.
That was
And then the 258, 574 is what's recommended.
what is recommended and in this budget being supported by ARPA funds.
Okay, I just want to make sure I'm reading it
Yep.
correctly.
Yep.
I want to ask that question again.
Thanks, Randy. Mike? And then Dan.
Well, I might have just heard the answer to my question, and I've been trying to read these tables across. For example, the mental health resource coordinator. I'm looking at the big pages here of the over target requests, and it says that, for example, the mental health resource coordinator is 100,631, and it says revenue. But is that because it's ARPA?
Correct.
And that's why it's not coming out of reserves.
Correct.
Okay,
Yep.
that explains that
Yep.
to me. The other question I wanted to ask Frank, when you, in your preliminary talk, you talked about the difficulty hiring people because sometimes we're not competitive. What is our competition? I can't imagine that it's other municipalities because they must have the same problem that we do.
Yeah, it's not. It's the private sector. right? In large part, whether it be hospital systems or primary care practices that are beginning to integrate mental health services to it, or just mental health providers. During COVID, we had a new local provider office that started, which is kind of a conglomeration of staff, and those are popping up where they serve as kind of it's almost like a primary care practice, but they're still kind of working independently. But those folks, a lot of times are able to work 100% remote. The compensation is better. There's no question. I mean, the amount that we're paying our social workers is the dollar value just on salary, I don't believe is competitive from what we've seen. And so they're able to go there, one, look at the compensation package, and on top of that, have the opportunity to work 100% remote. And it's very difficult to overcome.
Thank you.
Okay.
And I'm sorry, if I could just add to be, as a social worker, you're kind of like a doctor. You can just hang your shingle up, or a lawyer, where you can just hang your shingle up and practice. You can have a private practice of your own too. And so a lot of people are going that route because they can do that 100% remote as well too. So then it becomes, we're losing them to that sector where they're not dealing with the significance of billing. Many times they don't even take insurance, right? They will just charge a fee and it's a cash only. So we're also losing people to that pool that provides, I'm going to call it cash only services versus billing insurance and dealing with Medicaid and the added costs that go along with that. So there's that component of it as well.
Thanks again.
Okay, thank you. So I've got Dan and I've got Mike Sigler and anyone else? Lee, let's try to move along, people, because we're going to be over time already, and this is only our first department. Dan?
Thank you. So I wanted to ask about the Mental Health Association drop-in center OTR that is not recommended. Frank gave a little explanation of what he thinks is the issue with that one. I just wanted to hear from Lisa just to hear her thought process on that.
Yeah, I, after consulting with Frank on it, and in terms of the plan for sustainability, that I came to the same conclusion. It's certainly a policy decision for the legislature.
And sustainability meaning financial sustainability?
Yes.
Very good. Thank you.
Okay, Mike?
My question is quick, Frank. I don't know if you answered this. On your list of workers here, it's caseworker. In 2019, you had 8, and then you had 0 for a while, and then now you're up to 1. Did we just call them something else?
No, that was actually the vesting of our home care agency during our health home agency. I'm sorry, our health home agency during COVID. It was the casework program that had evolved over time, and it was a contracted program, and it was costing the county nearly $500,000 each year to subsidize it. And because of the COVID budget concerns, it was a program that we decided to discontinue doing. And so those positions were all eliminated.
Thanks, Frank.
Okay, Lee?
Just trying to understand the over target request, Frank, for the co-response teams and the reduction to 258,000 from the original. And that's primarily for 2 clinical support people to take over the functions of the response team.
So it's 2 clinical folks and 1 law enforcement folks, with the second law enforcement person being recommended funding from the city of Ithaca.
So this law enforcement person at the county level is coming out of your budget and not the sheriff's?
No, I'm sorry, am I confusing it? So
It's in the sheriff's.
So it's in the sheriff's budget. The only part that I would be covering are the 2 licensed clinical social workers. I believe the sheriff's OTR has a deputy position.
So 2 licensed clinical social workers are going to cost us $376,463?
I think modified to 200.
Yeah, it's modified to 258,574.
And then the rest of that will be in the sheriff's. Okay, great. Thank you. Mike?
Just a real quickie. When you say multi-year on your over targets, is that like a 2-year or a 3-year?
They didn't do that. I did that. So what I was doing was keeping track of what potentially could come back. So you will see this in other ones that could potentially come back so that we know if we may or may not have a deferred tax levy increase.
We already approved this for 3 years
It's a 3-year.
tentatively.
It's a
Yes, this is year 2 of a 3-year that we did last year.
Okay, probably somewhere it ought to tell us that.
It's in the book.
Is there another question, Taylor?
Yes, I have Veronica.
Okay, this is absolutely the last question. We need to move on.
Yeah, sorry. Lee kind of asked it, but just to clarify, looking at the same OTR for the co-response teams, or really a general question, maybe when there's an OTR for a staff person and an amount of pay is requested, and then what's recommended is some pay, but not as much. Does that mean that was requested was like a position with, in this case, a salary of like $120,000, and what's recommended is the same position, but with a lower salary? Or how to interpret the difference in numbers there? Like I'm looking at the regular pay under OTR number 51.
I can address this. I believe when we originally received this request, it included both the mental health proposal combined with the sheriff's proposal. And so that was what was requested, and we separated the two into the 2 different departments.
Okay, but then looking at the sheriff's, looking at the crisis response unit OTR under the sheriff's office section, I'm seeing a request there for like deputy sheriff, $143,000 something, and then recommended $80,000 something.
That's correct. There's a story there as well. So
Coming up.
Which will come up next.
Coming up next.
I'll wait eagerly.
Okay. Okay, Annie, you're absolutely it.
Has the city approved this yet, or are they going through their budget right now, or?
Mona went to Common Council last night with the proposal for reimagining public safety for 2023 as well as 2022. So it's under consideration.
And so this is part of reimagining public safety, this right here.
Correct.
Okay, thank you.
And last night, Common Council decided they didn't need to evaluate that until October or November. So just FYI. Okay. Thank you, Frank.
Thank you all very much.
And we're moving on now to the Sheriff's Department and the jail. And those presentations can be found in your book at pages 4-179 and 4-186. Derek, I know you're on there somewhere.
I'm here.
Okay, take it away. Derek?
I'm coming. I'm trying to share my screen. I apologize.
Oh, okay. I thought we lost you.
Oh, you're not going to get that lucky. Okay. Thanks for having us, and thanks for everybody that helped us, Lisa and Norma, for putting our budget together. It was a lot of work, and we'll get started. Some of the things that are influencing our work at the Sheriff's Office that are going to impact our 2023 budget, of course, is the ongoing reimagination work, which you already started talking about with Frank. We have some input on that as well. We also have a lot coming down the pipe with new gun laws and legislation surrounding extended background investigations, different licensing requirements for long guns, and also our extreme risk protection orders, which is adding a lot of work to our civil division under our law enforcement division in the budget book. If you look at this slide, there's a little bit of difference here. First, with expenditures, the $857,000, and then it later shows a change of $1,378,000. The difference there after you take out our OTRs is due to our salary increases on the road patrol due to the contract settling this year. So that's where that difference is coming from. As far as our revenue, there's quite an increase in that. And a lot of that is coming from funding that we were receiving through ARPA funding for our sheriff clerk positions, and also the deputy that we asked for and that was recommended for the co-response team with Frank's group. This is the number. I'm sorry, am I going too fast?
I just had a question. Are those negative numbers on your revenue? They're in parens?
Yeah, not
negative. It's
right.
Wait, I think you need to go back one, Derek. We seem to be having problems.
The budget book, it's just revenue, but I was trying to get my head around negative revenue.
Yeah, I mean, maybe Norma can answer that, but I'm guessing that's because it's
the way the over target requests are built into the budget book when you're looking at the over targets, but it's actually revenue.
Okay, thanks.
Does that mean revenue's going down or?
No, it's the way it's.
Oh, it's just
the way it's
straight up
expressed.
revenue. We
Yeah,
should
it's just
ignore
straight
the
up
parentheses. Okay, sorry, Derek.
No, that's okay. Our full-time equivalencies on the law enforcement division has a change of 7 positions. We're not flat out asking for 7 positions this year. As you'll see in the notes that 2 of our sergeants that were approved previously last year is over target are now moving from one time to target. That is the professional standards community engagement division that we created last year, which has been very successful and it's been a huge benefit to us at the Sheriff's Office. They are focused on our accreditation, centralizing our training across both the road patrol and our corrections division. So we're hoping to continue on with that. And we're also hoping to continue on with our pilot program on the sheriff clerks. So that's 4 of the 7 positions that are accounted for in those ways. And I think everybody in the meeting is familiar by now with the sheriff clerk program as part of reimagination and providing an alternative response. And again, the 2 sergeants that we'd like to continue in our professional standards division.
You have a question, Amanda?
Yeah, so we got this purple sheet and it differs from what's up there. And I'm thinking the purple sheet is correct?
Yes, it's 59.
It's 59, not 55. Okay.
We're good?
Yep.
These are a further explanation of the positions, the 7 total. We are asking for an additional civil deputy to help us out in our civil division. As you probably are aware, our civil division handles all our income executions, our permitting process, gun permits, background investigations, our eviction proceedings. One deputy just seriously isn't cutting it. We often have to pull from our road patrol to help with evictions. And it's just getting to the point where we can't manage with one. And we anticipate a lot more work starting actually now with, again, the gun laws that are changing, the requirement put on us to do extended background investigations, additional licensing procedures for long guns, and also the additional work that we've been experiencing due to our extreme risk protection orders. We also have an equivalent, full-time equivalent in here for a deputy sheriff for security at the Department of Social Services. I've had extensive conversations with Lisa on this, and I realize we don't know exactly where we're going with that, if we're going to use deputies or come up with a different solution. Nonetheless, it is in the budget for now. And I guess I can say I promise not to spend it until we decide what we're going to do, quite bluntly. Again, the third line down is the continuation of our sheriff clerk positions. They've been doing a great job. We're very happy to continue that program. We just need to continue funding those positions. And again, the continuation of our 2 sergeants in the professional standards division. And then we had requested 2 deputies for the Tompkins County Crisis Response Unit with Frank's team. It was recommended to do 1. I know it was brought up, the city of Ithaca. The last I heard, it sounds like they may provide an officer from that. I got an email from Mona just before we came on, and it looks like they may have interest in providing it. The issue we have with jurisdiction is the sheriff's office has jurisdiction throughout the entire county to include the city of Ithaca. IPD only has jurisdiction in the city. Frank has to provide services across the whole county. So it really is better if we can provide a deputy to handle stuff in the county, and IPD can provide a deputy to pair up with one of his people to handle stuff in the city. So that was the basis for the way we did that. Any questions on any of that before I continue?
I think Mr. Sigler has a question. Yes.
Again, I'm just wondering about the, what is it, OTR 61? That's a continuation of the sheriff clerk position. Wasn't that part of the reimagining?
Yes, that was part of the reimagination process. That's where that came from.
So
Yes.
how can that not be funded? I would think that that would almost have to be funded.
Yeah, and I believe we committed to a 3-year trial period. And so this would be for the 2nd year of that, as well as the professional standards division. That was part of reimagination as well.
I guess that's a question for.
Yeah, it's recommended to be funded to continue the 3-year one time.
Am I reading that wrong? I'm looking at recommending it. Oh, it just is ARPA funds.
We're using ARPA, so it's not coming out of fund
Okay,
balance.
now I got you.
Okay. Rich has a question as well.
The additional civil deputy, do you anticipate greater revenue as a result of having that person there?
Unfortunately, probably not. We have seen quite an influx in pistol permit applications come in, but I can't say, there's going to be a lot brought in from that. No, it's simply going to be trying to keep up with a lot of the mandates coming down from the state.
Okay, Shauna has a question and then Mike has a question. I guess you're not going to get to give a nice flowing long explanation, Derek.
Yeah, I wondered about the overtime for the law enforcement unit. It seems like it's been increasing every year. I know last year, 2022, it was a little bit lower. I guess my question is there a break point where you say, I hire 2 more deputies or 3 more deputies and we don't have as much overtime? And if we were to have that conversation, would you even be able to recruit 2 or 3 more deputies?
Yeah, I mean, as far as overtime goes for road patrol, the first 2 years of my term, it was down drastically. But then, COVID reared its head and we had to enact a hiring freeze. Then we lost some people due to reimagination when that first started. And it became a point when we actually lost 1/3 of our patrol force. We are just to the point now where we have rebuilt and filled our positions, albeit we have, I think 1 in the academy right now. We have at least 1 promotion to make, 2 in the academy, I'm sorry. So I anticipate this year we'll be in a better spot. Our overtime will go back down to where it was. We can certainly hire more people and that will alleviate the overtime. I think there's a negative aspect to having people work too much overtime. It burns them out, it tires them out, and they don't do their jobs as effectively, quite honestly. So, yeah, that is something to consider. We didn't ask for any road patrol deputies this year because we're trying to cover different areas and fall in line with some of the recommendations through reimagination. And, there's only so much money to go around, and we understand that.
Yeah, I mean, if, I don't know if there can be a discussion, maybe with administration as far as like if there's a happy medium, because $500,000 of overtime seems like a lot. And if we could hire deputies that we know, are going to stay with us for a while and, commit to the sheriff's office, and that might be the better route.
Yeah, and one thing, Shauna, to keep in mind too, the increase in the dollar amount of overtime also equates to an increase in the salary due to the contract going through. So it doesn't necessarily all equal the number of hours worked. So just something to keep in mind.
Okay, yeah, that makes sense. Thank you.
Yep.
Okay, thank you. Mike, did you have a question?
Yes, Sheriff, I wondered about the additional civil deputy sheriff position, the over target request. Did you look at the possibility of having someone short of a actual deputy doing clerical or assisting the civil deputy that you already have, so we wouldn't have to have such an expensive position added?
Yeah, we did think about that in great detail, Mike. The problem we ran into is, there's only certain things a civil deputy can do that a clerk can't do. A clerk can certainly help, or a civilian worker, with a lot of the paperwork in the office. But when it comes to actually investigating a background check on somebody filing for a pistol or now a long gun permit, and actually assisting in an eviction proceeding, which can be quite dangerous and volatile, and serving protection orders as well, we really need a deputy to do that. Some things that we have done recently with our sheriff clerks, above and beyond them handling certain calls, we have shifted some duties to them, like our sex offender management program. We removed that from an investigator because they can do a lot of that stuff over the phone, or people simply show up to do some paperwork. So we have tried to be very creative on what we can move away from armed deputies to civilians, but we just didn't feel it would quite work in this situation.
Thank you.
Okay, Randy and then Annie.
Looking at OTR 74 and was trying to understand the math of that. Is this the positions that we would staff down at the Health and Human Services building? Is that what that is? Because I know when we looked at the budget for that for just 6 months, it was a lot more than that. So I'm just curious how those numbers work. And I see interdepartment revenue. What does that mean?
Yeah, that the difference in why it shows so low on that thing is because the 33,000, obviously it's much more expensive than that. And that's reflected in our revenue line, because much of the money covered to fund those positions would come from DSS. That would be our portion to cover that.
And the DSS portion, they can draw down funds from the state. So it would only be a fraction of the cost for the county to subsidize.
So it's advantageous for that money to come out of DSS and go to the sheriff's office.
Thank you.
Okay, was there someone else? Annie, did I see your hand?
Thank you. Derek, thank you for the presentation. I had a question going off of what I think it was Shauna that already asked for about the overtime. And so it looks like the same amount you're asking for staff, and then also increasing the amount for OTRs, right? I'm sorry, for overtime?
That's just naturally built in because of salary.
Yeah, that's just naturally built in as an increase because of the salary increases due to the contract being settled. So therefore, when we pay somebody overtime, it costs more money because the pay rate is higher. So that just was changed to reflect that new salary.
Okay, and you said you're down a number of employees still?
We're really struggling in our corrections division, the road patrol, not so much. Like I said, we did lose about a third of our patrol force at one point, but we have rebuilt that. We've had a lot of new hires, a couple laterals. We have 2 in the academy right now. We have, I believe, 2 on long-term disability or on administrative leave, actually 3. Yeah, 2 that are in field training still. So we still have a ways to go, but for the most part, the positions are filled. The one on administrative leave, hopefully we'll have him removed from the books here soon, and we'll fill the positions, and hopefully we'll be back to where we were before. So it's been a long road, but I'm confident we're getting back to where we need to be.
Okay, and will that help reduce the overtime?
Absolutely, yes.
Okay, well, great. I know that takes a lot of work to get people through the training, and I know you work with them as they do that, and then to get them on board and additional training. So thank you.
Yeah, thanks, Dan.
Okay, let's let Derek finish before we ask any more questions. Sorry, Derek.
Okay, on to our corrections division, our jail. Not a lot has changed with our jail. We're not really asking for anything. Again, with the expenditure line, the $80,000 in OTRs doesn't quite match with the dollar amount with the change, the $893,000 that you see. That's quite a difference. Again, that is due to anticipated salary increases. We're hoping that the contract with corrections will be finalized this next year, and that accounts for that. Oh, yeah. The one OTR we did have, I'm sorry, this is the full-time equivalents. You can see that really hasn't changed at all. Again, we're having a really hard time staffing our jail. I'm hoping that will change if we get this contract pushed through and the salaries get bumped up, that we'll be competitive again, and hopefully we can convince people to stay. Honestly, we're interviewing people almost every other week. People are getting hired and leaving within a very short time. So if we're hurting anywhere staffing wise, it's definitely in our jail. One over target request we have for corrections is our fuel line. As we know, fuel has really gone up this year, quite scary. So when you have a department that runs a lot of vehicles on a 24/7 basis, we typically, we have fuel lines in both our corrections division and our road patrol. We're just asking for increase on the corrections side, because typically we spend down the corrections side first and then move over to the law enforcement budget. And that's all I have.
Amanda has a question.
Thanks, Derek. My question is just about the FTEs. You have the psychiatrist that was at 0.22 for several years and then up to 1 and now back down. So I was just wondering what that was about.
Yeah, I'm honestly not sure, Amanda. We do have one contracted psychiatrist. We've always had one. And it's like a per diem type where they tried so many hours. They're not a full-time employee. So why that says 1, I have no idea.
All right. And I may volunteer to go back and look at this. The budget software that we're using admittedly has been spitting out strange numbers for 2022. And all of the updated pages that we've been trying to get a hold of on it, but this it might be attributable to that, Derek, as well. So,
but you do
I'm
have
gonna go
one.
with that.
We can both go back and take a look and see.
Yeah.
They have 1/5 of
Could I
one.
chime in on that, Sheriff?
Who was that?
Great, Megan.
That's Megan.
Oh, Megan. Hey, I didn't even know you were
Yeah.
out there.
Oh, hey. To explain the 0.6s, that is originally we had our part-timers. So there's 4 part-timers, but they were counted as 2 full positions. So Norma and I had gone through together, and she explained that they need to be like 0.2s for each one based on the hours they're working, because they're not full times. So that would be the 0.6 is your Dr. Bezerganian, and then 4 part-timers on top of that. And I can't remember what the other one was.
She's talking about the 0.6.
Now I'm more confused.
Yeah,
I
I
think
am more
Megan and I, Megan, we'll have a conversation tomorrow. We'll figure it out and then we'll return to this group. How's that?
Okay.
That sounds good. Thank you.
Thanks, man.
Greg, you have a question?
Yeah, thanks. My question was on just looking at the fuel OTR. Do you buy fuel in bulk, or do the sheriffs, do the vehicles all fill up at retail, or do you have like a filling station at the facility?
We have gas cards that we get through the county that are usable at various pumps across the state, because a lot of times we do transports out of the area, so we have to be able to get gas anywhere. We do get a reduced rate based on that. I couldn't tell you offhand what it is, but we don't pay the full retail, no.
Okay. All right. Thank you for clarifying that.
Sure.
Lee?
More of a question probably for Lisa or so, the jump on the salary and wages line from the adopted 2022 to the target, is that reflecting anticipated increases with the contracts?
Was.
Okay.
If a contract isn't settled, we will pull that out and put it into
A reserve,
a
basically.
reserve for the coming year.
Thanks.
Okay, anything else for Derek? Thank you, Derek.
Thanks, everybody.
Thank you, Jen. I know you're lurking somewhere in the background.
Yeah, thank you.
All righty, have a good evening.
You too.
All right. Yay, we're like a couple minutes ahead of schedule and we can move right on to Mr. Steitley and Dewar.
Good evening, everybody. I'm going to share my screen. I can't share my screen right now because there's somebody else sharing.
Oh, yeah. Derek, you got to take your stuff down there. Uh-oh, did he leave? Okay. Okay, everybody, and you can find Dewar's presentation on budget book page 4-6.
Say that again.
4-65.
Okay. Is it okay to start?
Yes, please.
Well, good evening. Thank you very much for inviting us this evening to go over our budget. I would like to introduce the other people in the room. We have Jessica Verfus, our Deputy Director. We have John Halachek, our Communication Center Manager, and we have Jerry Lockwood, our Administrative Coordinator. So hoping that we'll be able to answer any and all questions this evening that the committee may have. I'd also like to extend my gratitude to Lisa and to Norma for their help in preparing the budget this evening. So thank you, everyone. So the first thing I want to really mention to the group this evening is that most of the change in our expenditures and our OTR is on staffing. We did a staffing study this year, and we put together a staffing plan for the next 5 years. The initial request was for 4 additional dispatch personnel starting next year, and then 1 additional dispatcher over the next 4 years. We were supported in getting 2 new dispatchers, and we're very grateful for that. But I just wanted to let you know that we did do a staffing study, and that study would be available to anybody that would like to see it. And we're really excited to share that. In addition to that those FTE spots, we also requested another FTE for a position that we're currently referring to as a data analyst. This individual's role would primarily be handling all of our discovery requests, which is pretty significant at this point, and we're splitting that amongst 3 people right now. And also some compliance needs and FOIL requests. The other thing I'd like to point out is the reason why you'll see a change in our revenue is because our one particular grant that we've historically have received at a much higher rate than we're going to be receiving over the next few years is our state interoperability grant. That's dropped significantly. So I just wanted to point that out, that's one of the reasons why you'll see that change on our recommended budget. So essentially The increase in FTEs would be going to 33. The reason why it says 33.5 is because last year we did a 2-year over target request for a 0.5 project manager for the backup center, and that position will sunset at the end of 2023. So that would then that would leave us then with 3 dispatchers and 2 dispatchers and a data analyst. This slide just speaks a little bit to the staffing study that we did and just an increase in overall call volume and activity in the 911 center, and some of the increased demands is being placed on the center that we thought would provide some context so you would understand why we're looking to increase our staffing the way we are and why we requested the number, because we do realize and recognize that it's a big jump in staffing. And again, we are very grateful for the opportunity to look at the 2 new dispatchers for next year. And then this is just a slide that speaks to a supporting slide for the data analyst position and some of the requests that we get. And you can see that it's quite a bit. And right now, again, this responsibility is being shared amongst 3 people. And sometimes, depending on when we get the request, it might pull a person away from another primary responsibility they have in order to fulfill that request. So this slide, I do want to point out, actually, it's the next one. So this goes over our additional staffing. If you look on line 2, it says page 69, it says 911 tower site electric bills. I'd like to point out that that's an error. So it is in part our electric bills, but it's also $15,000 is the over target request. I'm sorry, the target is for the electric bills, but there's a $50,000 number in there for the support and maintenance of our 911 tower sites that are beginning to age. And that $50,000 would be used to do routine maintenance on those facilities. So, and that is in the budget book, right? So there's some clarity on the budget book, but I just wanted to point that out on this particular slide. And that's it. I'm sure there's some questions.
Wow, that was fast. You get a prize. Okay, does anyone have any questions for the doer staff? Randy.
Yes, thank you. Where do local revenues come from? I think we talked about that at a previous meeting. I was curious, what are the local revenues at $580,000? Where does that come from?
I'm not entirely sure where the local revenues come from. I think it's probably related to 911 surcharge money, as well as payment from the city of Ithaca for the dedicated dispatcher.
And lease space and rents.
Tower rental lease space.
So just to clarify that point, because I'm sorry, I think we might have talked over one another. So there are some private partners that lease space on our 911 tower sites, and we generate revenue from those leases. Sorry, stepped on you.
Thank you.
Okay, I've got Henry and then Amanda.
Yes. In terms of the discovery request, I know that we funded another position in the past for that. What is your analysis, your staff analysis say about it?
Yes, absolutely. I'm going to ask John Halachek to address that because.
So my understanding from the previous funding, it went into the reestablishment of the professional development coordinator's position originally, which had went off book due to COVID. However, now that is part of that individual's duties. The problem that we're seeing is that the primary function of that position is for training, QA, QI, rather than completing discovery requests for the district attorney's office. The workload that is coming to us from the district attorney's office is at least a 0.5 FTE workload just for one specific function. And taking that person away for 50% of any given work week to just complete and address discovery leaves us in a severe deficit negative for all the other duties that go into the professional development coordinator's position. The other issue is when we receive those, we don't know the length of that request until you start to unpack it and get into it. Sometimes they're very benign, they may be turned around very quickly. However, if it's a lengthy incident or there are multiple agencies and departments concerned, that one incident can take hours to build and unpack. Now, if they're already committed elsewhere, then the duties fall to either myself or they fall to one of our senior supervisors, and we're leveraging one against the other to be able to complete this workload. It continues to rise, and I would note when Public Safety Committee does meet in the next week, the amount of requests that we completed last month was the highest number to date since we've started facilitating them. So they continue to go north.
Okay. Thank you very much.
Thank you, Amanda.
Thanks. I'm wondering if you could talk a little bit about OTR 63. I guess I'm just not following year 2 of 2. It says housekeeping amendment. Is this the project manager who's been doing this for several years and we're just extending it? I'm just confused.
This is the project manager for the backup center. The initial OTR last year was for a two-year, one-time for a half-time position. So half last year, half for 2022, half for 2023. And it will sunset at the end of 2023.
So why does it say you're changing from project manager to assistant director?
That's the title that they've.
So last year, when we asked for the 2-year OTR, we wanted to use the term project manager, but because we didn't have a term, we didn't have a position in accounting called project manager. They recommended that we just use a title that we already had in our department that wasn't currently filled. So we just used that title, and it met the same grade for salary. So that's why it's referred to as that.
So this person was last year a project manager, and now they're the assistant director.
They were the assistant director for.
Yeah, they've been, so on paper, they're referred to as the assistant director, but they're serving as our project manager for the backup center project.
Okay, thanks.
Thank you.
Okay, anyone else? Lisa?
I just wanted to say one word about the discovery, the position to help fulfill the discovery requests. And you'll see we're getting now what has turned into an ongoing source of revenue from the state through the DA to pay for discovery related requests. And the priority, there's kind of a pecking order as to priorities as to who receives the funding, starting with the DA, the Sheriff's Department, probation. And the DA certainly has an ongoing need for discovery support, and we'll see it in his budget. We're now reflecting this revenue in the DA's budget as an ongoing source of revenue. The sheriff and probation aren't as much affected by the discovery laws, but the Department of Emergency Response is. So half of the funding for this position will be covered through the state source of funding. So it's only about approximately 50% local cost to us to pay for that position at this point.
So does that money come from the state directly to Dewar? Does it go to the DA's office or through the DA's office?
It actually, we received notification of it through county administration. We've received notification of it for a couple of years in a row. We have to, and we are expressing it in all of those budgets. We're expressing it right now in the DA's budget and in Department of Emergency Response. But we collect all of in admin, collect all of the related backup needed to draw down the funds on an annual basis for these expenses and these, right now, their positions. So.
Okay, thank you. Rich?
I just want to make sure I'm reading the line correctly. 63, project manager. You're recommending that this be funded, but the funding is coming from ARPA money? It's not coming out of,
OTR 17? Is that the one you're talking, which one are you talking? 63. 63 is being funded by ARPA funds, yes. Correct.
so that's why it's showing 0
Correct.
in some lines, because we're not. Okay, thanks.
Yeah, Taylor. Oh, I see. It's Shawna.
Hey again. I was wondering, as far as the new project manager position, was that actually posted for people to apply for?
It wasn't a new position. That was something that we did last year. It was even, I think even before that, we had somebody that retired and then somebody that was retiring stayed in that position, moved into that position.
So Brian Wilbur was in that position as assistant director. He kind of transitioned into a role. The role he ended up having was to act as a project manager for the dispatch center. Brian has since retired, and we kept Jack on as a half-time in that role to be able to complete the backup center and manage that project so that it could be completed on time.
Okay.
Okay, is there anybody else?
Thank you.
Taylor, is anybody else waiting to speak? Oh, okay. Does anybody here have any more questions? If not, I think we are ready to move on, and we appreciate your crispness, Doer. Thank you very much.
Thank you. We appreciate it. Have a good evening.
All right. Now we move on to Kit Kephart and our Department of Social Services. That presentation can be found on page 4-190 of your budget book. Lisa has something to say first. And Norma has pages
that are related to this of social services.
Take it away, Lisa.
So as we pause for page updates, I wanted to take a moment before Kit and Tom and Dina do their presentation. I wanted to draw everyone's attention to the email that I sent out yesterday regarding a late news in mandate costs that were not factored into the in my 2023 budget projections and recommendations, unfortunately. There were significant state mandated increases in family foster home and adoption subsidy rates, which were only partially offset by the accompanying increases in state and federal revenue. So while we were in Tompkins County paying the maximum rates for the state, the changes in the regulations and increases from the state did have an impact to us here in Tompkins County. The bottom line nets out to be an increase of $541,607 in mandated costs in the DSS budget for 2023. Unfortunately, these swings in mandate costs that come at the last minute can swing us in either direction at any given year. So this year they affected us negatively. So rather than increasing our levy amount to make up for the difference, which would mean more or less a 1% levy increase. I'm recommending that some changes in what my initial proposal was, which include increasing our estimated staff vacancy rate by another percentage point from 1% to 2%, which would gain us approximately $378,000 toward this mandate cost. Decreasing the amount set aside for salary increases for the compensation study from 500,000 to 420,000, yielding us about $80,000. And then yesterday, we were also notified that room tax revenues came in above previous estimates. And so I'm suggesting that that surplus, which is 82,900, even a little, we've even heard today a little bit more than that, can go into the county's unallocated revenue line that will be used to help cover this mandated increase. So those three adjustments will enable us to cover this increase in mandate costs without impacting the tax levy. But I sent the email yesterday. I wanted to get it into the record so that everyone was aware that that's my recommended course of action.
Thank you, Lisa. I guess before we start with Kit's presentation, I'll give you all an opportunity if you have any questions about what Lisa just explained to ask them now. Okay, I see Shauna and Mike Lane.
Yeah, I guess I just have a question. So your first point was essentially decrease in the upcoming hiring. Is that right, Lisa?
No. What I was suggesting was but my first budget recommendation, we had projected conservatively that 1% at any given time, there's a 1% vacancy rate in the county based on the fact that there are open positions, we're waiting to fill them. And what I'm suggesting is we increase that estimate to 2%.
Okay, that makes sense.
So that goes from about 8 to 15, something like that, based on 750 positions. Yeah. Okay. That seems fairly conservative. Yes.
Okay. And then the second part was, as far as the decrease in the salary study, that is simply saying that you're not going to allocate the funds in your budget. However, it does not mean that in the end of this budget, we're not going to undergo the recommendations from the salary study. Is that right?
That's correct.
Okay, thank you.
Okay, Mike Lane and then Greg Mezzi.
So this idea of using the vacancy funds, I don't think we've ever done that before this year. And to me, what that says is that we are basically not having those extra funds go into fund balance. We're spending them in our operational budget. So I just want everyone to know that's a hit on our fund balance for next year.
Potentially, yeah. Okay, Greg?
Sorry, I put my hand down. I didn't unmute myself. So question with the 82,000, is that over the course of the year? Is that the 10%, or what is that 82,000? How's that calculated? Is that just from a quarter, or the money that's going into ST that came from room tax?
That was just, we received the new estimates later. And so that was the increase. That's not the total amount of room tax.
That's the increase in the county's share.
In the county's share of the room tax.
So that would essentially be that 10% that's carved off for the
Yeah, in the unallocated revenues, it would be, it will end up being, as if I remember correctly, it's about $207,000. Yeah.
Got it. Okay.
Okay, anybody else? Okay, Kit, you're on.
Thank you. And I'm gonna talk a little bit more about this news and what happens with foster care as I go through this tonight. So let me see if I can share my screen. So I just need to figure out here how to do this so that I am able to show you all the full presentation here. Okay, can everybody see that?
Yes, ma'am.
Okay, great.
It's done. Oh, there it is. Okay, congratulations.
Yeah, it's always a little tricky getting to where we need to go here. I'm here to present the proposed 2023 budget for the Tompkins County Department of Social Services. As you all know, I'm Kit Kephart, Commissioner, and I'd like to take just a minute to note that with me tonight are Dina Bodner, Deputy Commissioner at DSS, Tom Herden, Director of Administrative Services, and I'd like to introduce Thomas Toll, who is our recently hired Director of Administrative Services trainee. And thank you for having us all tonight. Thanks to Lisa and Norma for their assistance with putting all of this together for us. In the County Administrator's recommended budget, the pages that correspond to our budget are section 4, pages 190 through 199. So when putting together the budget, there are always challenges and considerations to take into account. And one of the greater challenges that the Department of Social Services always faces is what we know that we don't yet know as we develop our budget and look ahead to next year. We refer to these as our known unknowns. And social services always faces significant year-to-year uncertainty in how legislative and coming program changes may affect our budget. Our known unknown slide is a brief review of the areas that we are currently watching that may have the most significant impacts. So these known unknowns are not reflected in our budget request. However, they are important to be aware of as they have the potential to really impact our fiscal reality for next year. So currently, it is difficult to predict how national, regional, and local economic trends might impact economic assistance caseloads. Calls from families to social services inquiring about eligibility for cash assistance and the Supplemental Nutritional Assistance Program, or SNAP, have increased over the past 6 to 9 months as families are beginning to see the impacts of inflation and are paying more for things like food and gas. Another unknown, as you are aware, New York State's homeless population continues to increase, and Tompkins County continues to see those increases in numbers of individuals and families that are seeking shelter. Presently, Tompkins County Social Services is assisting a total of 108 people, that's 89 adults and 19 children, with sheltering related to homelessness. Just for comparison, at this time last year, we were assisting 52 persons with sheltering. So as we're all aware, there continues to be a need for extremely low housing in our county. So we continue to see lengths of shelter stays increasing as people are experiencing greater challenges in finding permanent housing to relocate to. It will not be surprising to us if this need continues to increase. However, this is an area that's very difficult to know what to expect and how to anticipate what exactly the need will be. Our next known unknown relates to funding for housing programs. For the past few years, our community has benefited from several housing programs that developed out of pandemic-related support funding. 2 of these were the ERAP, or Emergency Rental Assistance Program, and the Emergency Solutions Grant, or CARES ESG program, both of which provided federal monies delivered through New York State OTDA for families that were at risk of or experiencing homelessness, and also were adversely impacted by the health crisis. Presently, both of these programs are preventing evictions and have been extended into 2023. However, we anticipate that at some point in the future, likely in 2023, these programs will end. Recently, OTDA has introduced a new support that will begin in October of this year called the Rental Supplement Program. This will provide many similar benefits to the previously mentioned pandemic-related programs. And the Rental Supplement Program will be annually renewable, similar to the STEP program, which is Solutions to End Homelessness program. You probably remember supporting that with local dollars in the past. And I'll talk more about the Rental Supplement Program when I discuss our over target requests. What we really don't know currently about these housing programs is when the ERAP and ESG ends, will there be a significant increase in evictions and an increase in families experiencing homelessness? And will the new Rental Supplement Program offset the needs related to the close of these other programs? Presently, it's really difficult to predict answers to those questions, and some of the answers may depend on what happens with the economy and other factors that affect families. Another known unknown that affects families in our community are the questions surrounding childcare funding and programs. I want to take a moment to say here that this program is now known as childcare, but the state agencies used to refer to it as daycare, and you will see it listed in the county budget as daycare. Currently, New York State has made significant changes to expand the eligibility for low-income childcare, and we at Social Services have been actively promoting this expansion and encouraging families to apply. The state is making more money available to encourage utilization of this program. Presently, we at Social Services have more than twice as much money available in our child care block grant than we spent last year. Nearly all child care subsidies are reimbursed at 100% as long as there's money available in the block grant. However, the greatest challenge at present to supporting working families is the dearth of child care program slots for children in need. We have erred on the side of putting high figures in the budget for this year in hopes that we can support families who need childcare to enable them to work. However, again, it's unknown if the new childcare options that provide slots to meet the need will come through to support the care needs in our community. And another known unknown for 2023, OTDA has notified social service districts that as of October 1st of this year, the 45-day waiting period for determining eligibility for safety net cases will be eliminated. Instead, eligibility for safety net cases will be determined similarly to family assistance cases, with 30 days for the worker to determine eligibility and with benefits payable right away if a client is immediately eligible and in compliance. Additionally, eligibility for safety net is also broadening. However, due to the fact that family assistance cases are 100% federally funded and safety net cases are only 29% reimbursed by New York State, it is anticipated that we will see an increase in local costs related to this change. This is a bit of a double-edged sword. While the change that will mean that some of our most vulnerable clients in the community will not have a waiting period for benefits, which is a good thing, it also means increased pressures on staff to determine eligibility more quickly and likely will result in higher caseloads ultimately. Unfortunately, at present, it is really difficult to predict what the increases in caseloads will look like, how stress on workers will be impacted, and also how local cost will be impacted after this change has been implemented. And lastly, a big unknown relates to some Office of Court Administration proposed changes that, if adopted, would require that families that are investigated by Child Protective Services would be required to be provided with assigned counsel representation from the initial visit. This could have significant impact on the safety of children, families, the operations of child welfare at social services, and social service attorney in practice. Presently, this is a proposed change and has not been adopted. However, it's been discussed recently at the New York Public Welfare Association's conference this summer, as the impacts could be significant and far-reaching if it goes through. So on our next slide, we take a look at our recommended budget figures for 2023 compared with this year's adopted and modified budgets. So the two columns to the right of the table express the difference between the 2022 modified and the 2023 recommended figures, expressed as dollars and percentages. As you can see, the $2.9 million increase in expenditures is partly offset by the $1.9 million of revenue that's resulting in an increased cost of about $922,000. As most of you know, our department's budget is comprised of a mix of mandate and non-mandate programs. So in the next 2 slides, I'm going to talk about the major factors contributing to these increases that is shown on this slide. So this next slide will focus on our mandate programs. And the big news here is a double whammy. This is part of what Lisa was referring to. First, we were recently notified of large increases in state mandated rates for adoption subsidies and foster care that are retroactive to April 1st of this year. These rates vary based on the age and level of care need of the child. And the lowest increase is coming in at 9%, and the highest an increase of 45%, and the average being 21%. Secondly, we have received a large reduction in the state funding for foster care. This large cut of approximately $300,000 is related to a successful reduction in our use of foster care placements and therefore our expenditures. I'll talk more about this soon. And when we lower expenditures, it impacts the calculation of the block grant. I don't want to spend too much time here, but just so that everybody understands, for several years now, the state has been requiring districts to look for familial placements when a child must be fostered. So we in Tompkins County have really taken a proactive stance at working to keep children in their families, or in what is called fictive kin placements, which means placing the child with someone close to their family, even if they are not a blood relative. This is healthier for the child overall and results in significantly less trauma for the child and the family. And when we make these placements, we encourage family or fictive kin to become certified foster parents. However, many choose not to. It's a significant time commitment among other considerations to become certified. The child most often can still be placed with the family or fictive kin, even if they don't become certified. So again, we see a mixed bag here in terms of what's happening with funding. We have lower foster care numbers due to this phenomena, which is better for children and families. However, that also impacts the amount in our block grant that we as a county receive to fund our foster care program. And moving on to temporary assistance, there's some good news in family assistance. We were able to use some of our flexible fund for family services block grant to partly offset the increased cost of foster care in this program. In addition, we were presently projecting to spend about $452,000 local dollars less for safety net assistance. And lastly, our contributions towards Medicaid benefit, the Medicaid benefits during the first quarter of 2023 will be $289,000 less. Altogether, the local cost of our mandate programs is $138,000 less this year. And we'll move on to slide number 5, which covers the major influences of local cost of our administration program. So the box to the left on this slide shows total expenditure increases of $1.76 million, which are detailed on the right. It also shows these expenditures as partly offset by the $700,000 of revenue for a net local cost increase of $1.06 million. In the list of increased expenditures, $1.1 million of the $1.3 million salary increase is due to the contract increases that were adopted in late 2021. The other $200,000 increase is due to organizational changes within our department. And despite the increased payroll costs, the reduced fringe rate for 2023 will result in a $165,000 decrease in fringe rate. A $37,000 increase in equipment is the result of purchasing all electric vehicles, which are more expensive than hybrids. And the $11,000 increase in our supplies line has been mainly due to client transports, primarily related to independent medical assessments. Finally, our 2023 budget reflects $582,000 increase in contracts. This includes $727,000 in new over target requests, partly offset by the end of our payments to the Human Service Coalition for administration of the ERAP program and about $33,000 worth of other reductions. So I want to take just a minute to talk about an area where there are big changes to the numbers, but these changes are not influencing our net local cost. And the answer to that is our daycare program. Our appropriation for daycare is reflected much higher for 2023. However, because nearly all of our daycare subsidies are reimbursed by the state at 100%, while we will see our actual expenditures increase next year, it will have no impact on the net local cost of that mandate program. And unfortunately, I wish I could say that for a few other programs. So let's move on from what's happening with our programs to what is influencing changes in staffing at social services. Our economic assistance programs have seen the retirement of 3 of our division level administrators. That's a 60% departure of our leadership staff just on our eligibility program side. All of them have retired this year after 35 plus years of service. And while all of these leaders have so earned their retirement, it has been a year of transition as we have well over 100 years of experience depart our organization this past year. As this has happened, we've also altered our structure a bit to accommodate these changes. I'm pleased to say that Adele Ayers, who has been a division coordinator for many years, has accepted a promotion to the Director of Eligibility. And with every change comes opportunity. Many of our dedicated senior social welfare examiners have been promoted to principal social welfare examiners to provide oversight of specific program and service areas. All of these changes have taken place over the last handful of months, and we continue to promote and fill positions on various levels that have been left vacant as retirements have occurred. And as you know, over the past few years, we also have had several extremely long-term staff in our accounting unit leave. We continue to see minor adjustments in this year by adding a principal account clerk typist and another conversion to this title from senior account clerk, from a senior account clerk title. And these changes have largely been made as we've continued to determine what is needed to distribute the work that was handled by those long-term staffers after they retired. We've also seen some staffing changes on the child welfare side of our organization as well. The significant changes here are the promotion of a senior caseworker to a case supervisor, which has been necessary as we've required more supervisory oversight of our family treatment court unit. The most significant change here, however, is the addition of 4 caseworker positions. Child welfare programs across the state have seen recent challenges due to the labor market, turnover of staff, periodic staff leaves and absences. And these factors coupled with the reality that a caseworker cannot perform the job independently until they've completed 8 to 12 weeks of state training, and this training is often not available to them until they've worked for us for about 3 to 6 months, has really left our trained workers covering higher than normal caseloads for extended periods on top of assisting in newly hired staff. So as we have struggled with these realities, we found our child welfare division chronically understaffed over the past few years. And we made the decision out of necessity this year to get ahead of the curve and add additional caseworker positions so that we would have a consistent influx of persons hired, being trained and moving toward independence as turnover, illness, and other staffing impacts continue to present challenges. And the last point to note here around child welfare is that child welfare work continues to really increase in complexity and intensity as families reflect greater needs. And in a post-pandemic world, we continue to see greater mental health concerns, substance abuse, and domestic violence that contributes to pressure on workers to establish safety for children and to help families find their way to stability and health. And our last area of change in our full-time equivalents for social services is in administration. Again, we see the impacts of retirements. As I mentioned earlier this evening, we have hired a Director of Administrative Services trainee in anticipation of our current Director of Administrative Services retiring in an approximate year. Our Director of Operations retired after 32 years of service, and while we don't anticipate hiring into that title at present, we do hope to hire a facilities and security manager, as this is currently a role that myself and other administrative staff have been fulfilling for some months now. We also show a reduction of security officers here. One of these positions was a staff person that had been encumbering a position for some time, but had not been working due to a leave. And 2 nominal half-time positions have been replaced by 2 per diem positions. And our next slide shows how the department's full-time equivalents have changed over the last few years. Although all of these changes that I've described reflect considerable reorganizing, in all they are an increase of 3.5 full-time equivalent positions. However, this is only about 1 FTE higher than was actually approved in 2017. So moving on to our over target requests. Oops, I'm sorry, I didn't advance that slide, I apologize. So moving on to our over target requests, this next slide shows our over target requests in order of priority. The description of the positions and the line items are in the budget book, section 4, pages 198 and 199. County Administrator Lisa Holmes has recommended funding for all of our over target requests for 2023, and we're grateful for that. The first over target request is for a Sheriff's Department deputy to monitor a magnetometer for the Human Services building. We appreciate the support around this OTR, as everyone is aware of the increase in acts of criminal activity in the corridor where the HSB resides. The second over target request is to provide the local contribution towards the rental supplement program. Social services will receive almost $462,000 towards this program from New York State OTDA to assist families with homelessness prevention and rapid rehousing. And as I stated previously, we are hopeful that this program will really help us assist families face rising housing costs and risks of evictions. Our third over target request is to support a respite bed, as was approved in the 2022 budget, to be covered with ARPA funds. At present, we have contracted with a provider to help develop a couple of families who are specially trained to provide respite services in their home for children in need. As we discussed last year, as Family First legislation became effective last year, it discourages congregate care placements in favor of family-type settings for children who require out-of-home care or respite care while in foster care or kin settings. Presently, the provider has been working to establish these placements and unfortunately has not been able to do so. However, we are working with them to expand the search area and to see if we can develop this option. It is of significant need, so we feel it's worthy of every effort to see if we can make it really come to fruition. We're grateful that Lisa is again supporting this program and recommending ARPA funding. Our next over target request is a proposed increase by 5% to all the local agency contracts that social services maintains to support our mandated programs. As the challenges of the current economy and the labor market have emerged post-pandemic, we are hearing from our local contract agencies that they have greater expenses for their businesses and that they are having to pay more to retain staff and hire staff than in the past. Some have lamented that they have not been able to meet those costs and have lost staff. After most of these organizations have asked social services to increase supports for their services and contracts, we are proposing a 5% increase for all local agency contracts. These services would make it possible for social services to meet our mandated requirements, and frankly, without them, we would need to increase our costs significantly to meet our mandated program requirements. Lastly, our final over target request is the cost of increasing information aides compensation in our department to meet the living wage standard. So finally, on our last slide, we wanted to note a few potential needs that did not make it into our over target request for 2023. Currently, we are not asking for local funding to supplement the STEP program, Solutions to End Homelessness program, that we receive annually through OTDA. This program has been very successful at preventing evictions and providing a rapid rehousing option for people in the community. And as you know, the legislature has provided additional funding for this program in past years. Presently, we're waiting to see how the rental supplement program will assist with these needs and whether the emergency solutions grant will be extended before developing a full outlook of needs in this area. And lastly, as we noted on our known unknown slides, it is difficult to predict currently what the needs could be for staffing for economic assistance programs in the coming year. The combination of changes in program requirements coupled with unknowns like the coming state of the economy, labor market, and the end of existing rental assistance programs make predictions about caseloads and community need very difficult. However, we are not asking for over target needs in this area at this time. So as I mentioned before, we are grateful that all of our over targets that we did request were included in the recommended budget. So I'd like to open it for any questions. Thank you in advance for your time and consideration for all that we've put forth tonight.
Thank you, Kit. Questions? Mike Lane.
Very nice presentation. I did wonder about the your OTR 75 for the deputy. Why is that one time? Why shouldn't it be continuing? Aren't we going to be back again next year having to fund this as well?
I'm just trying, sorry, I stopped sharing my screen and maybe that wasn't wise. I'm going to Sheriff's Department. So on my over target request slide, this actually is listed as multi-year. Did I not have that on the?
It said multi-year.
Okay.
So are you saying this is a 3-year or 2-year or something?
Well, I think it's difficult to predict right now. I think that currently purchase of a magnetometer is underway. And I think that, I think what we're looking at is trying to staff that, having somebody monitor the magnetometer and be able to really increase the safety for our building. I think we'll have to reevaluate once that gets put into place, whether or not we can remove that at some point. Currently, I would say that we are seeing a lot of activity that really increases risk around our building. So I don't see that unless significant changes happen in the community. I don't see that changing right away. But I think that's certainly up for reevaluation.
So it's like a trial at this point.
Yeah, I think so.
All right. Thank you.
Sure.
Okay, I've got Randy and then Greg.
Yes, thank you, Kit. I'm glad to see you're increasing caseworkers and speaking to people at schools. They definitely feel a need for that. But I had a question on reduction of the 2 security officers. Are you still going to have security officers there internally, or how many will be left?
So I think currently, Randy, right now, we, and I would say the Department of Social Services, but the other department heads as well in the Human Services building, and Lisa and Bridget have all been kind of talking about this. I think we're trying to kind of figure out what things are going to look like once we actually get the magnetometer up and running and we have a sheriff's deputy here. I do anticipate right now that we are going to need security staff. I think that there's enough activity within our lobby where we're having to have people who are kind of facilitating situations as they come up and communicating with clients, that we're going to need that. But I think that's going to be something that that's going to be something that we're going to have to wait and see how that goes. And I don't know, Lisa, if you have anything to add here to what I'm saying.
I think right now, as we're in this transitional phase and trying to get this implemented, there are standing positions in white collar that are unarmed security officers. And we're talking about the potential for, and the plan to bring armed security as well from road patrol. Without anyone who is in a current position losing their current position. So and then once we change the staffing, it's going to impact the situation in one way or another. So I think that we want to position ourselves so that we can see how changing the staffing will impact the situation before fully staffing all of the existing positions. And we wouldn't want to let anyone go if we don't have to.
Thank you.
It looks like Tom Herden might have something to offer on this. I see his hand.
Yes, thank you. I just wanted to clarify. So to answer Randy's question, with the elimination of the equivalent of 2 FTEs that are reflected in our 2023 request, that still leaves 3 full-time security officer positions. As Kit mentioned, of those 2 FTEs, one of those was only in our budget because we had a fairly long-term employee who was still with the department, but who had not actually worked for the department for an extended period of time. When that person finally separated from service, we didn't need to continue to fund that position. The second of the 2 FTEs that we're eliminating, we're not actually reducing the available security officer person power. Historically, we had not been allowed, our department had not been allowed to have per diem employees. And so we had 2 nominal half-time employees in security officer positions, but they only worked intermittently to cover absences of the full-time staff. Late last year, or maybe early this year, there was a rethinking of that, and we were given permission to convert those nominal half-time positions into actual per diem positions.
Thank you.
Yes, thank you, Tom. Okay, Greg, you had a question?
Yeah, more of a comment. One, Kit, great job. Really appreciate the presentation. Really thoughtful. I was trying to keep up with my notes, but failed to do so. In your known unknowns, you had a lot of great supplemental detail and additional sort of facts. I was wondering if you could share that. I assume you maybe had it typed out with the rest of the legislature, because that was good information and I just couldn't write it down fast enough.
Sure. Yes, I can come up with a bit of a summary for that and send that out to people. Yep.
That'd be great. I'd appreciate that. Thank you.
Sure.
Are there unknown unknowns?
We oftentimes talk about the known unknown, unknown unknown. We go back and forth. Yeah.
Channeling Donald Rumsfeld, bless his heart. Okay, anything else? I can't. So Henry.
Yes, I assume that the informational aid became ineligible for living wage with the new living wage.
Yes. Yes,
Okay.
it was one of those things where the new standard came out and we realized that was a position. I think that was actually I think we were directed to go ahead and make the modification based on the fact that position no longer met that standard. So yeah.
Okay, thanks.
Sure.
Amanda?
Yeah, thank you. Thanks for the presentation. I have 2 questions. One is about OTR 56, the respite bed. So that's ARPA funds. But you said it hasn't been successful this past year. I guess my 2 questions for this one are, do you feel like it's going to be successful in this coming year? And what do we do with those ARPA funds if it's not? Like, are you using the funds somehow? Yeah, maybe you could say more.
So I can probably answer one part of that question and not so much the other. But what I can say is what we always try to do is minimize the distance that any child has to be placed away from family of origin. We always try to set up visits. We always try to keep people connected, whether it's family of origin, whether it's a kin placement, if it's, a foster care placement. So what has happened over this last year is the contract agency has really been promoting this within our county. Our county has historically we've had a very difficult time finding foster families in our county, and especially for older kids, which is, these aren't going to be infants that are going into respite. These are older kids, and they are kids oftentimes that have very challenging situations. So in the next year, we are going to be, or currently, we are working with them to really expand that catchment area and to begin to kind of go, again, it's less ideal, but try to expand that area and begin to kind of push out a little bit, see if we can find families. If we can make this work, it will be a significant help to our programs. So we really want to try to make that happen. And with changes that are coming, even more changes that are coming with the implementation of Family First, we know that we're going to need this. So if we can make it work, we're going to try. As for the ARPA fundings, I don't know, Tom, is that something that you can speak to?
Sounds like
it. Yes, in part. I think part of what Amanda asked was if we're spending any money now, even though we don't have a bed. So I wanted to respond to that. We are not. The arrangement that we have with the provider, the contract that we have with them, once they have found one or more families and have trained them, then we will be paying the agency a monthly fee for having found, trained, and supporting that family or those households. And in addition, we will be paying those families a fixed amount each month, basically for being on call to provide this service. And then for however many nights they actually have a child in their care, we will pay an additional amount per night. So right now we haven't yet to date spent any money, and we won't spend any of the ARPA money unless and until there are one or more families that are recruited and trained. I wanted to mention also that, so part of the reason we believe, in addition to the obstacles that Kit mentioned, our provider had some staffing difficulties themselves, some turnover of staff, and the person who they had been expecting would be recruiting and training families left their agency. It took them time to hire a replacement. So they were a little slow in getting up and running and even trying to recruit folks. We have had preliminary conversation with them, but it's not yet conclusory conversation about whether it may make sense for us to increase the amounts that we would pay to families. Given the status of the labor market now, perhaps that would help in the recruitment and retention of those families. The part that we really can't answer, Kit or I can't answer, and maybe Lisa or Norma can, is to whatever degree we end up not spending or claiming this ARPA funds, what will happen with those funds?
Well, my understanding is that we've already committed them to government operations, and we therefore have until December of 2024 to use them. So we can just divert them to another government purpose as long as we spend them by the end of 2024.
That's correct. And there have been instances in the 2022 budget where we've learned that the funds are not going to be used as intended. So they've come back into the pot to be reallocated.
Okay, great. That's all very helpful and good to know. Thank you. I do have another question on OTR 57, which is a 5% increase to local agency contracts. And I did look in the contract section, but it doesn't say which local agencies. And I was just wondering if you could tell us.
Sure. I just have to find my backup here. So I can read through these. It's a list of agencies. I think, Tom, I'm gonna let you jump in here as well, because there's some specifics about this, but then I can say exactly who they are. So we're talking about Catholic Charities, Child Development Council, Human Service Coalition, Law New York, OAR, St. John's, the Advocacy Center, Learning Web, and Tompkins Community Action. And I know there's another piece, Tom, I'm going to let you speak to that.
Sure. I just wanted to clarify. So a couple of things. So this OTR reflects that the effect of that 5% increase for those local human service agency contracts that we pay for out of our administrative program. And the part of those expenditures that are not otherwise reimbursable by the federal or state governments. So we have some agency contracts that are funded on an open-ended basis that the 5% increase is not reflected in this over target request because it can be covered with state and federal funds. And we have other agency contracts that, because they are paid for through our mandate programs, there isn't a way to represent those in an over target request. The fiscal target only applies to our administrative program. So
Okay.
Hopefully that was helpful.
Yeah, no, that is helpful. I guess I'm just, so we also fund some of these through like the Human Services Coalition. So I feel like this is news to me this year. So we're funding some of these organizations twice. Is that correct?
But we're funding them through the Human Services Coalition just for general operational purposes. These are contractual relationships that we're paying for services. That's my understanding.
Yes, that's correct. And they're related to, you know, all of the work that they're doing are related to our mandate programs, that if we didn't support them in doing the specific contracted function that they are, we would have to find another way to do that as a county, as our department, we would have to find a way to do that to meet our mandates. So.
Okay, that makes sense. Thank you.
Sure.
Anything else for Kit? Lee.
Just a comment from a freshman here. I just am amazed in the scope of what is essentially a $50 million budget that you've presented us tonight. The recommendation is for a grand total of $40,000 in ongoing target increase. And given the volatility of the economy and what's going on out there in the supply chain and labor market and everything else, I'm impressed.
It's mind-boggling, isn't it?
It is. And the only sad comment is, as I see it, is that out of the one-time or funding that we've got, over half of it is toward security at that facility that doesn't really do a thing for our clients other than provide.
Well, it keeps them safe.
Keeps them safe, but hopefully, to Mike's question earlier, that parties will get a handle on things down in that neighborhood. Thanks.
Thanks, Lee.
Thank you, Lee.
Okay. If there's nothing else, thank you, Kit. You actually have enough of an evening left to enjoy it.
Thank you. I hear there's a Bills game, so I don't know if others are going to partake, but that seems to be the focus with some of the team over here. So.
Okay, that's good to know. All right, good night.
Thank you. Good night.
I want to thank everybody here. You were excellent crispy critters tonight, and let's keep it up. Thank you. We're adjourned.
Thanks, Deb.